This is an important one just to point out because you have not had this in the past and it's in play for this year. And this is part of healthcare reform. The out-of-pocket maximum is the most you would ever have to pay out in a plan year for services. And that would include your deductibles, your co-pays, your co-insurance, any dollars that are coming out of your pocket, prescriptions is another one, would all add up to this single out-of-pocket maximum, which is $6,600. And this is all noted, it's in your books, and it will be again later in the presentation.
Is that single?
That's per member. The family is $13,200. And once you've met that out-of-pocket maximum, should you incur all those costs, everything would be covered in full thereafter for you, or for your family members if you met. Yeah. And the premium is the amount that you pay. It comes out of your paycheck to belong to the health plan. Any questions on any of those definitions? Okay, so the name of the program, HMO Blue New England Choice. This is the name of your new program, and has some important new plan features that we're going to point out. PCP. In the past, you've been required to have a primary care physician, but you have not been required to get a referral from your primary care physician. This new program requires a referral. Okay. So everyone's going to have to select a PCP or keep the one you have already in place. But if you need to see a specialist or you need services beyond that, you'll have to get a referral from your PCP. Okay, so that's a big change. Annual out-of-pocket limit, I mentioned this just a few minutes ago, is set at $6,600 per member and $13,200 per family. Like I said, it includes all co-payments, co-insurance, deductibles, and also your pharmacy co-payments as well. So that's anything you pay out of your own pocket goes towards your annual out-of-pocket limit. Should you meet those maximums, your services would be covered, your benefits would be covered at 100%. Okay, everybody clear on that one? And then again, the biggest component here is the new two-tiered benefit design plan. And it's really, you'll see it on page 11 in your employee books. It really is two levels of benefits that are driven by hospitals and primary care physicians. So their tier 1 will have lower deductibles and co-payments. Tier 2 will have higher deductibles and co-payments, and I'll get into the details of that in just a second. The same features that are still in play, however, are preventative care, still covered at 100%. All participating Blue Cross Blue Shield providers in Connecticut, Maine, New Hampshire, Vermont, Massachusetts, and Rhode Island are your network. It is a New England-based network. You still have in play the no-cost. Good, excellent. So that's all still in play. If you go to these labs, LabCorp, Quest, Nord, DX, and Converge, your lab bill will be paid at 100%. Okay, so that's a good tool to use for cost savings. Compass, how many people have used Compass or know what Compass is? Excellent, thank you. Compass is another opportunity for you to save money. So Compass is still in play. If you know you have a surgery coming up, or you need to get an MRI, or you have some x-rays, you might want to call Compass and see where the best place, they will send you to the best resource, the most cost-effective resource to go to, and you can earn money back as well, just for making that phone call. I do want to just specify, because this came up in our meeting yesterday, Beth, about Compass, and I know I'm going to pull you in for a second, but with regard to Compass, or maybe it was yourself, I apologize, but you have to make that phone call. It doesn't, we can't just look in the book and see who they work with. You have to make the call. They have to know that you are participating in this in order to get the cash incentive.
Before you walk in the door.
Before you walk in the door.
Yes,
very good.
That's the key.
Thank you. Yeah. Okay, so let's get into the benefit design. As I mentioned, there's two tiers of benefits. Tier 1 is based upon certain hospitals that fall into the tier 1 category and PCPs that are associated with those hospitals. When you're working in a tier 1 benefit plan, you have a $15 copayment for primary care physicians. That's a better benefit than you've had currently. I think currently you're paying $25. To see the specialist, you're gonna get a referral from your primary care physician, and you're gonna pay $40. That too, I think, is a better benefit. Currently paying $50.
Excuse me,
Yes,
is this somewhere in here?
page 11.
Thank you.
It's not the actual presentation, but it's the benefit plan. Can you not see it? Because I do have a copy of the presentation.
No.
Okay. So just going back to, I'm at ambulatory surgical care, $125 copayment. That is a change from this year. Currently it's $75, but that will be consistent on both tiers, tier 1 and tier 2. PT, OT, ST, again, specialty visit, $40 copay, same as chiropractic, it's a $40 copay. It's across the board on tier 1 and tier 2. The deductibles is where you're going to see a big change. $2,000 single on tier 1, $4,000 on family, that's what you currently have. If you use a tier 2 facility, you're going to pay $4,000 for single, $8,000 for family. An important feature of the deductibles that I just want to point out, and again, I'll get into more detail about how you can use it this way, but those deductibles cross-apply. So if you're working with a tier 1 provider or hospital and you've incurred $2,000 worth of deductible, and you now need to go to let's say a tertiary or a Dana-Farber down in Boston, they're a tier 2 hospital, that $2,000 will already fill towards your $4,000. You'll only have $2,000 more to fill on the tier 2 side. And it works the reverse of that as well. So they completely cross-apply. Coinsurance under tier 1, this is a benefit. There is no coinsurance. Once you've met your deductible, your services at the hospital will be covered in full. On the tier 2 side, it's 20% coinsurance. ER, it's a $250 copayment across the board, regardless of where you go. We understand that in an emergency situation, you're doing the best you can and you need to get services right away. So they're gonna, that benefit will be consistent between tier 1 and tier 2. And the urgent care is $125 copayment.
I have a question on that.
Yes,
That's only the facility fee, right? That does not include anything else.
that is correct. That's correct.
Okay, so x-rays, CTs, blood work is
Right.
all deductible.
Yeah.
Yeah, that's a copay, just as if you're going to your PCP and paying $15, you go to ER, it's $250 copay. Right, everything else will fall under the deductible.
So you are, I'm sure, anxious to see which hospitals are in tier 1 and tier 2. So we're gonna lay them out for you, and I'm gonna show this to you in multiple ways. Here's your tier 1 hospitals. I'll just run through the list for you. Alice Peck Day Memorial Hospital, Cheshire Medical Center in Keene, Cottage Hospital, Elliott Hospital, Frisbee Memorial Hospital, Monadnock Community Hospital, Parkland Medical Center, Portsmouth Regional Hospital, Southern New Hampshire Medical Center, Spear Memorial Hospital, St. Joseph's Hospital, the Memorial Hospital, Wentworth Douglas Hospital. I think he meant Southern New Hampshire. Oh, no, he's there, Memorial Hospital. All right. And tier 2 hospitals are Androscoggin Valley Hospital, CMC, Concord Hospital, Exeter, Franklin Regional, Huggins, Lakes Region General Hospital, Littleton, Mary Hitchcock Memorial Hospital, New London, Upper Connecticut Valley, Valley Regional Hospital, and Weeks Medical Center. I'm going to show it to you on the map so you can see the difference. These are your tier 1 hospitals and where they're located in the state. And these are your tier 2 hospitals and where they're located in the state. And I think as you'll note that as you go north, the majority of the hospitals are falling into tier 2. That is where the services are the most expensive. It's also where it's harder to contain the costs. And Anthem has come out with this product in an attempt to allow employers and employees to try to manage their costs, but they looked at these hospitals and they grouped them based not only on cost, but also on quality outcomes. So the hospitals that you're seeing in tier 1 are hospitals that are working with Anthem to really manage and contain and from a quality perspective, help them keep those costs down as best as possible. So you might ask, what is going on in Massachusetts? Massachusetts also has this same product, and they've organized their hospitals in tier 1 hospitals and tier 2 hospitals. So we've listed for you the hospitals in Massachusetts that fall into tier 1. They're really small. I'm not going to read them all. But we do have this information. It will be available on the website as well, online. You can access all of this detail. And the one footnote I will just mention is I know that Massachusetts is also going back around this again in January for 2016 and reevaluating their hospitals. So you might see just a little bit of fluctuation based upon that reevaluation. Hopefully for the better. Yes, do you have a question?
No.
Okay. And these are the tier 2 hospitals in Massachusetts. Again, this will be on the website. If there's anyone in particular that you want to look at, I'd be more than happy to talk to you about it. And then we put it on the map as well. These are some of the tertiary care hospitals that you might be thinking about. Tufts Medical Center is tier 1. Beth Israel is tier 1. Boston Medical Center is tier 1. Dana-Farber is a tier 2. Brigham and Women's is a tier 2. Mass General is a tier 2. And Boston Children's is a tier 2. I think the important thing, actually, I'll just step back. So we just wanted you to know and to be aware that the network is all of New England. So you might ask if you live, which probably may not apply to anybody here in this room, but should you live outside of New Hampshire or Massachusetts, Maine, Vermont, Connecticut, and Rhode Island, those are all considered to be tier 1 providers at this time.
Or if you do live in New Hampshire and want to use a provider, and
Yes.
you live on the Maine border or the Vermont border or whatever, that's another, or you're in that location for care.
Yes.
Everything falls in tier 1 because they don't have this network set up. So by default, you kind of win in those states, so to speak.
Thank you.
I hope that's a good way to explain.
No, it is. It's an excellent way. And it will matter more for people who might be living in the North Country or further up along the borders. All right, I'm going to go through a couple of examples of how the benefits play out. And we're going to use Beth and Kathy as our examples today. So the example number 1, Beth is utilizing services at a tier 1 facility. Her cost of services that Beth has at tier 1, she goes to see her PCP for a back issue. That cost is $150. He sends her off to her specialist, and she sees the specialist. The specialist visit costs $400. She needs lab work, so she goes to the lab, and the lab services cost $250. She then requires surgery. She goes to a tier 1 hospital. She goes to a tier 1 hospital, and the surgery costs $20,000. The total cost of her services, $20,800. But let me tell you what Beth paid out of her pocket. Beth paid $15 to the copay for her PCP, because she used a tier 1 PCP, $40 to the specialist, $0 because she used LabCorp, and LabCorp services, lab services are covered in full. $2,000 for surgery. She hit her deductible right away, and her total costs are $2,055. Real simple. I'm going to show you the same thing if she uses a tier 2 facility. And I just want to reiterate that this is your choice. You can use tier 1, you can use tier 2. You can pick and choose when you want to use tier 1 and tier 2. You can be seeing a tier 2 primary care physician, realize that you need a surgery, and make a change. You can change to it or ask your physician, can you provide that surgery to me in a tier 1 hospital? Or can you hook me up with somebody who can? So at any given time during the plan year, you are picking and choosing where you want to go. But it is driven by your primary care physician and what hospital services you're using, which hospital you're using. So now Beth has decided to have her surgery at a tier 2 facility. She goes to see a PCP for her back issue. The cost of the service is $200. She gets the same referral to a specialist. It's $500. Her lab work is $300. Surgery at the hospital costs $20,000. Total cost of services, $2,100. Beth pays out of her pocket $30 copayment to the PCP, $40 copayment to the specialist, $0 because when she gets to the lab, her deductible has been met, and I think that's mixed up actually. She goes for her surgery and pays $4,000. And then 20% of the remaining 16,000 she ends up paying is 2,600 co-insurance. Beth's total out of pocket is 6,600. Now, what I want to point out here is she's using all tier 2. So these are your benefits on tier 2, the $30 copayment for PCP, the $40 copayment for specialist, and then $4,000 for deductible. Her total cost out of pocket is $6,600 because, as I mentioned earlier, that is your annual out of pocket max. It's the most that Beth would have to pay out of her pocket, and then services are covered at 100%. Okay? Just the copays. That's correct. Yeah. So this is just her costs at a glance. Tier 1 scenario, her total costs were $20,800. Beth's out of pocket was $2,055, and her deductible has been satisfied. In the tier 2 scenario, her total costs were $21,000. She paid out of her pocket $6,600, and her annual limit has been satisfied. So in this particular example, Beth could have saved a lot of money by using tier 1 facilities and providers. You can see that between the $2,000 out of her pocket and the $6,000. And I think that's what we're trying to show you, is that there is significant cost savings in using the tier 1. But she still has the flexibility to go to a tier 2. So no one's forcing you to make that choice. It's a choice you can make at any time when you're requiring or in need of care.
And I don't mind sharing with you, this is a pretty real life example, and the doctor that I did use, I could have done these things. She works at a tier 1 and a tier 2. Right. So this could be a very real example for
a good example.
Yeah.
And it's a little bit of a shift in the sense that we're asking you to be the consumer of your care and to really be informed and know what tools and what resources you have and how it works, so that you can make better choices as to what you want to pay out from your own money. Okay, now we have Kathy. Kathy's utilized, I'm just going to do this one more time. I hope this is helpful. I'll try to just go through it a little quicker. Kathy is utilizing services at a tier 1 facility. The cost of services Kathy has, she sees the PCP for an issue with her leg, again, $150. Gets the referral to a specialist, $250. X-ray, she needs an X-ray for it, $450. He doesn't see what he wants to on the X-ray, so he sends her out to an MRI, $2,000 for an MRI. These are pretty realistic costs just that are associated with this. The total cost of her services, $2,850. But what she pays, is $15 copayment to her PCP, a $40 copayment to the specialist, $0 for the X-ray because the deductible was already met, $2,000 for the MRI, which is where the deductible picked up. And we put this in the order because we just wanted to present to you, like many times when you're in, and I'm sure you've all seen it yourselves, when you're in getting services, some of those claims don't come in on in the same order that you might have received those services. Deductibles will be picked up based on as the claims come in. Kathy's total out of pocket in this situation is $2,055. Kathy continues utilizing services at tier 1 facility. The cost of Kathy's services at the tier 1 facility for physical therapy, $250. Specialist follow-up visit is $350. Crutches for walking, $500. Follow-up MRI, $2,000. Her total cost of service is $3,100. Okay.
I just noticed that you hacked services at tier 1.
Yeah.
I'm gonna fix that one.
I have
Kathy,
services.
yeah,
Like
you
a cowboy hat, would you say, like Borsalino?
I like hats.
Kathy paid out of her pocket, $40 copayment to the specialist for her PT, $40 copayment for a specialist visit, $0 for DME, as her deductible was already met for crutches, $0 for the follow-up MRI. Again, her deductible was already met. Kathy's total out of pocket in this situation is $80. It's benefiting her to use that tier 1 facility. In the cost at a glance, just looking at example 3 and example 4, comparing them, total cost of services $2,850 versus $3,100. Kathy's out of pocket $2,055. in example 3, and in example 4, Kathy's out of pocket is only $80. The tier 1 deductible has been satisfied, and that's why it's such a low expense. If Kathy chooses to continue utilizing tier 1 hospitals, her deductible for the plan year is satisfied, and she will only pay copayments. And again, I mentioned earlier, the deductibles do cross-accumulate between the 2 tiers of benefits. Very important to remember that you are in control of where and how you get your care. Okay. How do I save money? So again, I told you we were going to give you tools or provide for you resources to show you where you can find the savings in this plan. If you utilize tier 1 hospitals and primary care physicians, you're going to reap the benefits of savings in your pocket. You want to make sure that you're utilizing the no-cost labs. That's a feature that's in your plan today, and it continues to be in this plan moving forward. You go to the designated labs that we have highlighted, those labs will be covered at 100%. If you utilize urgent care or walk-in centers, instead of going to the emergency room for non-life-threatening issues, you will pay a lower copayment. So the emergency room copayment is $250. If you went to an urgent care, instead, it's $125. And we want you to take advantage of the mail order prescription program. Again, I mentioned that the pharmacy benefit is exactly as it is today. That has not changed, but there is significant savings if you use the mail order program. You'll get a larger quantity for a lower cost. And use generic prescriptions whenever possible. A couple of the resources that are, again, are tools that are still in play. Compass, this Compass Smart Shopper program still in play. You can get money back for utilizing Compass. In that one example, I actually should have shared with, had Kathy used Compass, she actually could have earned money and not, instead of paying $80, she could have made $70 just by using Compass with that one example. The Anthem Cost Estimator online tool is still in play. This is a valuable tool that Anthem puts on their website that can help you sort of figure out what your costs might be and which direction you might want to move in. And the 24-hour nurse line is also available. And I think, as I mentioned, the prescription benefits have not changed. So that pretty much covers where we're at today, and I just want to open it up for some questions. These are just, there's an app available if you want to do that. But again, I just want to say, like, we're asking you to be informed, to be invested in this program, and finding where the value is, and to be in charge and making your own decisions about your health care. Yes.
The tier 2 facilities are generally more expensive.